Hi everyone, my name is Zuzu. I am the dental hygienist at We Smile Dental, and this video we are talking about OHI, aka the way you should brush and floss and take care of your teeth at home. Okay, so on this setup I have typical things that I recommend to my patients. We have our toothbrush, and when it comes to how much toothpaste we should be putting on, we should be literally putting on just a smear. The old recommendations were a pea-size amount, but the new recommendations are a smear. And if I can get this open, I can show you. It's literally just a smear. Okay. We also have floss. We typically ask patients to use the as much floss, pretty much the length of their forearm to the tips of their fingers. We have Stimudents here, and they come in a little matchbox, and you just grab one little triangle and use that. We have floss threaders for those patients that have braces or retainers or bridges. You pretty much use this as a needle and thread, and you use the floss through it and thread it through the interdental spaces. We have these gum soft picks, which again help clean in between the teeth, and you just pretty much grab one piece, and I'll be showing you all this in moments to come. This is what that is. We have Proxabrushes that come in various sizes. We have the yellow ones are ultra tight, green ones are tight, magenta, I guess, are moderate, and the blue are wide. And these are again used to clean in between the teeth. And then we have a floss aid, kind of the little football, you know, post with the string in between. Sometimes they come in a more compact version. These are good for patients that have trouble with flossing, you know, with the traditional floss in between, or patients with dexterity problems such as rheumatoid arthritis. So when it comes to brushing, we recommend a modified Bass technique. Here is the toothpaste with that smear of the toothbrush with that smear of toothpaste. And what we do is open. We angle the toothbrush bristles down towards the gum at a 45-degree angle, literally just brushing 2 or 3 teeth at a time. Close just a little bit. So we go 1, 2, 3, 4, 5 on those 2 teeth. Go on to the next. 1, 2, 3, 4, 5. Next set of teeth. 1, 2, 3, 4, 5. Go on to the next. 1, 2, 3, 4, 5, and repeat this all the way through. Once you're done with the bottom outside, open. You can do the inside, again, angling those bristles down to the gums. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. When you're doing the lower front teeth on the inside, we do more of a vertical stroke. 1, 2, 3, 4, 5 in one direction, and then 1, 2, 3, 4, 5, and then continue with the back teeth. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Same thing for the top. Angling those toothbrush bristles up towards the gums, starting in the back. 1, 2, 3, 4, 5. Moving forward. 1, 2, 3, 4, 5. Moving forward. 1, 2, 3, 4, 5. All the way around. Open. Then the insides. 1, 2, 3, 4, 5. Similar. All the way on the insides, and then the insides of the front, same thing. Vertical strokes. 1, 2, 3, 4, 5 in this direction, and then 1, 2, 3, 4, 5. For an added bonus, put your teeth together, edge to edge, edge to edge. You can go in circular motions for 10 seconds just to make sure you're cleaning these teeth the way you're supposed to be doing. That's your modified Bass. For those that have recession, we also recommend to kind of sweep up so that we're not really scrubbing on the gums and causing more recession. So now we are flossing, and what we normally do is we wrap the floss around one middle finger and then wrap the other side to the other middle finger. And as we floss, we wrap with the dirty and unwrap with the clean. So the purpose of floss is to go in between the teeth, around each space, around each tooth. So each space has two sides. This particular space has the side of this tooth and then the side of that tooth, and go in the gums up and down. So I'll show you on the top here. We use our index fingers to guide the floss, and once I'm in that space, we wrap the floss around one tooth, go up and down into the gums, and then wrap the floss around the other tooth and go up and down into the gums. We wrap dirty, we unwrap clean, and we keep on going. Up and down into the gums, up and down into the gums. Now for patients who have retainers or bridges that the floss doesn't go directly through, we use a floss threader, and what I do is I tie a little knot so that it won't fasten off of it, and we go underneath that retainer, floss this through the back and feed it through, and then same concept. We go around one tooth, up and down into the gums, around the other tooth, up and down into the gums, and then just pull it out. We can do the next area. Open a little bit more and pull it through the back. And then once, just a little tighter space here. Once we're in, we go up and down into the gums, up and down into the gums, and we pull it out. Now, something else that we can use to help clean in between the teeth are the soft picks and the Proxabrushes. Both serve the same use. It all depends on what you want. So what you do with this is you just go in between the teeth and you just go in and out. This patient tends to have tighter spaces, so you don't want to force it, only where it actually fits, and you can go in and out. So kind of like little pipe cleaners. And again, remember, they have various sizes. They have the ultra tight, tight, moderate, and wide. This is the tight. She can probably use the ultra tight in most of these areas. And when you have wires such as this, these also are good to help clean underneath the wires as well as in between the teeth. Now, something that I love to recommend for patients with gingivitis are these Stimudents. They're triangular in shape, and the reason I love this is because it stimulates blood flow to the gum tissue, so it keeps the gums nourished and healthy. And what you pretty much do, flat side towards the gums, open and moisten the tip with your saliva, close and moisten it, open. You just go in between the teeth, in and out, in and out. Again, promoting the blood flow to the area to keep your gums nourished and healthy. Lastly, I want to demonstrate the flossers to you. And this, again, open. It takes the place of the floss. You just go in between the teeth. And once you're in, same concept. Up and down into the gums, up and down into the gums. Making sure you're rubbing each side of the teeth. This one as well as this one. One thing I failed to mention, with the Stimudents, Johnson & Johnson's used to be the old creators, but now the Stimudents are being made by the natural dentist. So when you're looking for these at the store, make sure you look for the natural dentist. And one thing that I absolutely love that takes the place of like the floss threader and the floss is this kind of 3-in-1. It's made by the Butler Gum, Sunstar Gum EasyThread Floss, and as you see, it comes in a spool just like regular floss, this green part being the stiff end to feed through, the white part being the fluffy or puffy floss. You pull it through until you reach the green again, and then you can tear off. If you've gone too far, you could kind of rewind it and then tear off. And again, this takes the place of the floss threader with the floss. It's an all-in-one, an absolute must-have. So that's all we have for you right now. If you like this video or if you find it informational, be sure to give it a thumbs up. And as well, look at the video's description for all the links of the products that we use today.